to talk about Dr. Soumya Sareen. She's a consultant neonatologist working at Avitis Super Specialty Hospital, Palakkad. And she did her MBBS from Pariyaram Medical College and PG from Calicut Medical College. She was awarded the President's Gold Medal as a national topper for her DNB pediatrics exams. After that, she took fellowship in neonatology from Indian Academy of Pediatrics. She is very active in social media and runs a Facebook page with more than 5 lakhs of followers. There she educates the public regarding the different health issues and treatment modalities. And she won the Best Social Media Performer Award from Indian Medical Association in 2019. And she's a regular face in the TV channels for the COVID-related discussions. Over to you, Dr. Soumya, to introduce the panel and to carry on with the proceedings.
Thank you, Vinay. Thank you for the nice introduction. Good afternoon, all. Thanks to Times of India for giving me this opportunity to moderate such a wonderful session. As we all know, COVID has changed our lives a lot. As in any other field, medical field especially has undergone many changes or is likely to undergo many drastic changes in the near future. So we are so lucky to have all the 5 eminent panelists here to enlighten us regarding the current scenario in health sector and moreover on the new normal mode of health sector in the near future. First, I would like to introduce all the 5 panelists here. Our first panelist is Dr. Harish Pillai, CEO, Aster India, Aster DM Healthcare. Welcome, sir. Second one is Dr. K Hariprasad, Group President, Apollo Hospitals. Third one, Mr. Arvind Ravi Kumar, CEO, Web Cardio. Next one is Dr. Saji Kurutukulam, Head of the Department of Cardiology, Medical Trust Hospital. Last one, Mr. Eldo Kuruvilla, Founder, Vedatma. So first, I'll be giving a short introduction of all the panelists each, and after that, they'll be giving a talk of around 10 minutes regarding the health sector and the future opportunities. First, I would like to welcome Mr. Dr. Harish Pillai, CEO, Aster India, Aster DM Healthcare. Dr. Harish joined Aster DM Healthcare as a Group CEO of Aster MedCity, Kochi in 2013. His exceptional leadership qualities helped him to get promoted as a cluster head, and eventually in 2018, he was promoted as the CEO of Aster India, that is currently spreading over 5 states with 13 hospitals and 9 clinics. Prior to joining to Aster DM Healthcare, Dr. Harish Pillai was the CEO of Egypt's biggest private tertiary care hospital, As Salam International Hospital, Cairo, for around 7 years. He is one of the most influential leaders of the Indian healthcare industry. Dr. Harish Pillai is a member of JCI Standards Advisory Panel, member of AHPI, that is Association of Healthcare Providers. He is a national chair for FICCI, a visiting faculty of Tata Institute of Social Sciences, Mumbai, and also Administrative Staff College of India, Hyderabad. Dr. Harish Pillai has featured in the April 2018 cover story of the Healthcare Radius magazine and was conferred with a special jury award for CEO of the Year in the first Healthcare Hospital Summit and Awards in May 2019. Welcome, sir. It's over to you, sir.
So thank you, Dr. Soumya and Times of India for giving us this opportunity. Most often before the pandemic, some of us probably were struggling to convince regulators to put the due spotlight on health sector and our own unique demands and requirements. But the pandemic has made our job much easier because clearly healthcare professionals and providers are clearly in the front line of national consciousness. A country like ours, which aims to be a superpower, like we keep talking about the year 2030 or 2050 from an economic point of view, but from a social point of view, one of the key indices is to boost health sector as a strategic sector. We always talk about defense being a strategic sector. It is very important that health sector and health services are also given the due spotlight in that manner. If you look at currently in our country, the percentage of GDP spent as an allocation towards health sector, it's very abysmal. And our wish list is that the spending boost has to be minimum 5%. If you have a 5% spending, then such kind of unpredictable epidemics or pandemics can be easily tackled. The only state for that matter in our country is the state of Kerala. That also because of, it's probably a quirk of history, political history, that in 1957, the state of Kerala elected a communist government led by EMS Namboodiripad. And ever since, irrespective of ideological affiliation, you have close to 5% of GDP in the state invested for social sectors, both for education and health sector. Hence, the state can boast about a certain advanced public health system, which is probably on par with OECD countries. We have seen in this pandemic that in spite of having such substantial investments in public health infrastructure, the state of Kerala unfortunately has been the last in terms of the surge of the pandemics. And as we speak, the 14 districts in the state is still trying to cope up with these pandemics. So coming to the main point is that what are the current needs and the future needs, what the sector needs. So a couple of points I would like to just mention before I touch on this topic is that in the past, from 2014 onwards, when we look, there have been some landmark decisions taken by the government of India to boost accessibility, affordability, and assurance in the field of health sector in India. Number one is, I would say, the launch of the world's largest universal health insurance scheme, Ayushman Bharat, which has given a safety net to almost 500 million of our citizens, mostly below the poverty line. Earlier, many of us were quite aghast at the incidences of pushing towards below poverty line due to single episodic exposure to private healthcare. So Ayushman Bharat is an attempt to mitigate that and provide access to qualitative, curative medicine to large amount of citizens. Number two aspect is there is an acute shortage of healthcare workers in India. We keep talking about a 6 lakh shortage of doctors and almost a 2 million shortage of nurses if you want to meet the WHO prescription per population base in our country. Therefore, I feel that the reformation in the medical education sector by the advent of the National Medical Commission, which in fact the act was passed by Parliament in September 25th, 2020, will help us in a great way to mitigate the requirement of producing more healthcare workers in the sector. This is one aspect of it. The National Healthcare Skill Council, which also talks about grassroots level health workers in a large numbers, especially in allied specialties and paramedical fields, will also help to mitigate the shortage of healthcare workers in a big way. Another landmark event which took place in this Independence Day was the announcement by the Prime Minister of the country in formulating the National Digital Health Mission. For the first time, we would have the architecture put in place from a regulatory structural point of view, which will help our country and our sector to have a massive quantum leap in digital adoption by healthcare workers. Like a point which you mentioned, Dr. Soumya, about telemedicine, is just one facet of the digital health mission. So that is another part. We are also happy that in the past few years, in the assurance part, especially minimum assured quality of care, the push by the Government of India and various state governments to adopt the Clinical Establishment Act. The purpose of the Clinical Establishment Act is primarily to create a minimum benchmark for quality of healthcare by all providers in India. I think this kind of efforts will really boost the appetite where a common citizen can be assured of a certain level of care. Yes, there has been a paradigm shift where health sector is concerned. Traditionally, if you're a middle class Indian, especially a middle class Indian child who is very good in academics, then the parents expect that the child would either go for engineering or for medicine, not looking at the remunerative capacity of these professions, but because of the coveted respect which these professionals command in society. I would say that this was probably true about 2 decades back. I'm not so sure right now, because people also realize that the challenges confronting healthcare workers across India. One big challenge which we face, and of course Times of India also has been on the forefront of reporting, is the growing distrust between consumers of healthcare and providers across the country, which results in unfortunate events where healthcare workers are rough handled by members of the community, and there has been legislations put into that. But this growing trust deficit is a challenge which I'm afraid casts a doubt on the prospects of healthcare as a viable profession for the youngsters in the country. People and society do not realize the enormous sacrifice which a student of medicine or a nursing or a paramedical profession takes in terms of investing their life to get that basic education. It's not that you finish an undergraduate education and you get your license to practice and that's the end of it. Probably you're just beginning of the journey where you have to go into post-graduation and further subspecialization. So when you look at the life cycle of a super specialist in medicine, you can easily talk about a straight 25 years, which is a combination of your credentialing in terms of education and hard practice in the clinical field. So that is something which society and everyone for that matter need to recognize, because at the end of it, you create that kind of brain trust, which is a great asset to the country. The pandemic has taught us one thing. Among all the morbid data, what we get in terms of mortality ratios, the most disheartening aspect is the amount of frontline healthcare workers, doctors and nurses who have lost their life in the fight against COVID-19. And that is an enormous loss to society and healthcare. So one, few take-home messages for youngsters watching the forum. Of course, we encourage youngsters to come in droves to our own field in terms of being good doctors, nurses or paramedical staff. It is not only in our country, but our country is also a springboard for brain trust for other countries in the world. A lot of countries, for example, in the United States, the US House of Representatives have passed legislation to get hold of pending green card to accelerate the induction of healthcare workers from other countries in the world in order to cope their own pandemic. Post-Brexit, United Kingdom has also dropped the barriers to induct more healthcare workers. Therefore, entering into healthcare is definitely it's a fantastic opportunity to serve humanity, and you can really make a good career for yourself. New fields which are emerging thanks to digital transformation is in the field of, for example, in the field of data analytics, in the field of artificial intelligence, algorithms. There is so much out there which actually merges the field of information technology, health sector, and these are new inflection points which creates more opportunity for youngsters in this field. So these are my opening remarks. Thank you, Dr. Soumya.
Thank you, Dr. Harish. Next, we'll be moving to Dr. K Hariprasad, Group President, Apollo Hospitals. Dr. K Hariprasad serves as a Group President of Hospitals Division at Apollo Hospitals Enterprises Limited and served as its CEO of Central Division. Dr. Hariprasad has been employed with Apollo Hospitals since the year of 1999. Prior to holding the designation of aforesaid in the company, he served as the Vice President Medical of Apollo Hospital Enterprises since 2003. He was previously served as a consultant in anesthesiology and critical care and also as a director of emergency services. He has a total working experience of 19 years. Dr. Hariprasad received his MBBS from KMC Manipal. Over to you, sir.
Good afternoon, Soumya, and thank you very much. Me and Harish have been on multiple panels, and I guess a lot of things will be repetitive, but at the risk of being repetitive, I'll still go ahead and say what I have to say. These are an unprecedented times where unpredictability is the rule and uncertainty is the norm. The year 2020 will be marked as a landmark in history. Many will remember it as a disastrous year, while few will mark it as a year when change began and a new normal emerged. Despite all the hardships and misery mankind is enduring at this point of time, being an eternal optimist, I would like to mark 2020 as a year which changed the world, hopefully for the good. Despite the crisis, healthcare sector has shown the resilience, not just to survive, but has thrown up creative solutions to tackle the pandemic. While some of these innovations are specific to the pandemic, most of them will become a part of our healthcare system and change the healthcare landscape in India. Those who are waiting for COVID to disappear miraculously and are hoping to return to business as usual are in for a rude shock. COVID is here to stay, and the transition to a new normal has started. Those who leave behind the luggage of the past and embrace the new normal will survive, while those who do not will perish. Digital healthcare, preventive healthcare, diagnostic tools, therapeutic options, behavioral patterns of the community, expectations of a patient, models of care are all changing. The first lever to accelerate growth is to be a part of this change and make it happen sooner than later. This, I believe, is the lifeline for the sector and the new normal. Teleconsults, teleradiology, telepathology, EICU, wearable devices, artificial intelligence, PHR, 3D printing, and numerous other digital options are available today and are being adopted rapidly by different stakeholders. Digital health is an important lever for growth and has the potential to be the difference between success and failure in healthcare. With the advent of new technology, better understanding of the disease process, and higher skill levels of the providers, newer models of care are emerging. There is a significant shift from traditional hospital-based care, outpatient care, daycare procedures, minimally invasive procedures, home care, even care in hotel rooms, and remote care are gradually becoming the mainstay of healthcare. We are moving into an era of healthcare where more people will get better care, but hospitals and beds will become less relevant. This is something which the sector needs to bear in mind while planning expansions or building new projects. Capital that is being infused into the sector needs to be channelized into the right buckets, and that's the new models of care. While everyone is looking at the devastation caused by COVID, I'm actually looking at the opportunity it has created. Healthcare has never, like Harish said, never received so much attention from the government or the community ever before. Not a day has passed in the last 6 to 8 months where healthcare was not in the headlines for good reasons or bad reasons. What COVID has done is it has exposed the gaps in our healthcare system and thereby giving us an opportunity to fill these gaps. While technology in its various forms will fill some of these gaps, the human resource gap is glaring and frightening to say the least. We need to double the number of doctors that we have, triple the number of nurses that we have, and increase the healthcare technicians by 4 times. These are humongous numbers, and unless we wake up to this reality, the gaps in our healthcare system will widen. Where is this human resource going to come from? India, and particularly Kerala, has all that it requires to deliver enough skilled and trained healthcare resources, not just for India, but for the world. While we are struggling with the pandemic and getting into a new normal, creating human capital is a huge opportunity, and we should do everything possible to leverage this opportunity. This is a must for Indian healthcare and will also have a major impact on Indian economy and job creation. While we have heard of people across the spectrum losing jobs due to the pandemic, doctors, nurses, and technicians have not lost jobs. On the other hand, there's a huge demand for the healthcare workers, and organizations are actually paying more for this segment of people. Healthcare is not only about doctors and nurses, like Harish just said. There's a huge list of possible careers in healthcare, some of which include management, health quality experts, billing and coding experts, dental assistants, phlebotomists, pharmacists, physician assistants, medical transcriptionists, medical records technicians, laboratory technicians, home health aides, radiology technicians, radiotherapy technicians, social workers, occupational assistants, optometrists, physiotherapists, healthcare IT technicians, digital technicians in healthcare, and the list goes on. I can go on with this list. Apart from the opportunities I've already spoken about, COVID, though sadly, is creating a whole new disease burden in the country. The after effects of COVID are beginning to add to the existing disease burden of NCDs and infectious diseases. Over 60% of those recovered from COVID have prolonged ailments, some of which are serious. This is adding to the morbidity and mortality in the community. While I don't consider this as an opportunity for healthcare, I genuinely feel it is the responsibility of healthcare sector to prepare and deliver solutions to the post-COVID syndrome. While this crisis needs to be sorted out in an efficient and compassionate way, we need to look at the immense opportunity it provides. We need to move to a new normal, and anything new brings in with it new opportunities. This is not going to be the last challenge the world will face. There will be another sooner than later, and each challenge is an opportunity. Maintain social distancing, wear masks, follow hand hygiene, stay safe, and keep healthy. Thank you very much, Samya.
Thank you, Dr. Hariprasad. Sir, we know you have another meeting at 4 o'clock and you have to leave early. So before moving to the next talk, I would like to ask one common question. This question is open to both Dr. Hariprasad and to Dr. Harish. Sir, the medical career is highly evolving with the advent of technology. So automatically, there will be a decrease in the chances in some medical specialties. But at the same time, some new opportunities are emerging in another medical specialties also. So what is the trend you are observing nowadays or in the post-COVID time? Are there any medical specialties which are going to be in limelight in the post-COVID time? Dr. Hariprasad, sir.
Yeah, I think in the current times, the one specialty which we would need to, which comes straight to your mind is the infectious diseases. I don't think there are more than 100 infectious disease specialists in across the country. This is a relatively new specialty, and I think it's here to grow. And this pandemic has actually thrown up a huge gap in this particular specialty. The second specialty is actually mental health. India never used to bother about mental health, but COVID has again taught us the importance of mental health. Sitting in at home in lockdown, working from home, all sorts of new things have come in, but each of these have brought in a new challenge as far as mental health is concerned. So I guess psychiatry was always there in the country, but we are now looking at a different need in the field of psychiatry, which is the mental health. And I think that's going to be huge. And third thing is India was always considered a young country with a young population. But when you take it in terms of absolute numbers, there are enough number of old people in our country. And I don't think geriatric medicine has gained the importance that it should have gained by now because of sheer volumes. There are a huge number of people, and the problem of problems of health problems of a geriatric patients are significantly different from those in the younger age groups. So the understanding of a geriatric patient and the way to deal with them is completely different. And I think geriatric medicine is another area which is going to become more relevant as in the days to come. The last one, but not the least, is what I call the telemedicine. When I talk about telemedicine, it's not just the teleconsultations or what is really known about, but I guess it's a lot to do with application of the digital technology to healthcare. I think this is one segment where a lot more of input needs to go in, a lot more of skilling needs to be done, and a lot more of understanding needs to come in. Having said that, I think Harish will add a few more.
Yes, thanks, Dr. Harish. So few other points where I feel there are some interesting opportunities is AI is coming up in a big way in all fields of pattern recognition. Pattern recognition, whether it's in the field of medical imaging, because one challenge in all hospitals in India is X-rays often are not reported by a radiologist. So we have that problem. So AI bots are coming into picking out those outliers of reading common X-rays. Number two is dermatology. That's again a pattern recognition field where AI is coming up in a big way to augment dermatologists. Third is in terms of tissue pathology, where we already are finding significant impact of AI in not only augmenting in some case where you don't have those subspecialty tissue pathologists present, AI is actually stepping in to filling in that vacuum. So these are three pattern recognition field where AI is coming up in a big way. I wouldn't say that these the human specialist would become obsolete, but AI is going to augment and complement their work. That's one field. In addition to what Dr. Hari talked about, infectious diseases specialists, what our country sorely lacks is epidemiologists, public health epidemiologists, because one of the most cynical observations which I have is that it is basically bureaucracy which has managed the public health crisis in India. With due respect to the Indian Administrative Service and others, they don't have the scientific acumen or training to manage public health crisis. So we need to create a cadre of epidemiologists and healthcare economists. These are two things which our country needs, because one always get puzzled when people talk about costing of healthcare services. It's not based on any economic science or principle. It's just arbitrary and based on populism rather than reality of the actual input cost. So these are two things which I feel is very important. There are also segments in the early days of the pandemic. What we realized is not much thought has been given into the synergies between biomedical engineering, public health, and medicine. For example, we talked about the acute shortage of ventilators, where even automobile manufacturers had to step up to convert their production facilities to increase the production of ventilators. PPE kits are something else, and there is also a growing field in the area of medical scientists, especially in medtech field, where there is large amount of startups coming, not just in teleconsult, but many aspects of the ecosystem, whether it's clinical or non-clinical, can be automized, and healthcare workers can become much more efficient. Therefore, that is a growing segment which I'm sure will create employment opportunities and also create a cadre. One last point: after the pandemic, I feel that due to our experience, India will have a giant rebound of medical value travelers coming from other countries to India, and there is a necessity to create a new cadre of medically certified language translators. Like typically, for example, someone comes from the Middle East, you have somebody knowing Arabic trying to translate, but everything is lost in translation. What the patient said and what the doctor understood due to this non-medical certified translator is a big challenge. So I feel there is an opportunity to have certified language translators in healthcare. So that could be a new emerging trend. Thank you.
Thank you, Dr. Harish. Dr. Hariprasad, you were mentioning about post-COVID syndrome, right? Actually, we know the studies are showing around 50 to 60% of the COVID positive patients are suffering from post-COVID syndrome. And I read that Apollo hospitals are planning to start post-COVID clinics all over India. So do you want to add anything to that? We would like to know more about it.
And I think it's the responsibility of the health sector to respond to the needs of the community. And it's more than 60%. Actually, you would be surprised that we've seen many patients who come in with post-COVID syndrome type of symptoms, and they've never had COVID. So when we did the RT-PCR, they were negative. But when we did the IgG antibodies, they were positive. So these were those asymptomatic carriers. When the COVID was active in its infection, they didn't have much of symptoms. But they are falling prey to the post-COVID syndrome. So there is a huge load of such patients in the community. If we see 100 positive patients, there could be another 100 patients who were positive but were asymptomatic, so they were not counted into the list. So that, and some of these conditions, I mean, I've heard of people who had COVID just dropping dead suddenly. We've seen a number of, people who have come back with acute MIs. We've seen people coming back with acute strokes, lung fibrosis, dyspnea is being continuing, and they need to be treated for breathlessness. So there are multiple things which are happening, and unfortunately, what's happening is once they get out of the hospital, or once they are said that they are COVID negative or their RT-PCR is negative, people tend to take it easy and they're not really concerned about what's going to happen. And it is today established as a multi-organ disease where any of the organs can be affected, and there is a definite post-COVID syndrome which is there in the community at this point of time, and it is well recognized and it is scientifically proven. So to be able to help these people, I think the best way to do it is to help them identify the possibility of a particular ailment or a particular system being involved early, and help them to take preventive measures or to nip it in the bud, treat it early, and make sure that they don't land up in the serious complications of the post-COVID syndrome. So this was one of the reasons why we started the Recover clinics, and we are already beginning to see that a lot of patients are coming in who never knew that their TMT was positive, or who had a TMT before the treadmill test before they were infected with COVID and was negative, but 3 weeks or 4 weeks after the COVID, it turns positive. So we're beginning to see many such patients, and we are happy that we launched it, because we are able to help people from landing into the serious complications of the post-COVID syndrome.
Thank you, Dr. Hariprasad. Now we move on to our third panelist, Mr. Aravind Ravi Kumar.
Soumya, just a second, I want to apologize to my co-panelists. There's just so many of these panels happening all across, so I need to join another one, so I'll excuse myself and I want to apologize to the rest of
Sir, can you stay for another 10 to 20 minutes? Because we have 2 or 3 questions more to ask.
10 minutes is fine.
Okay, then I'll move on with your question, sir.
Yeah.
We can continue later.
Yeah.
So, one more question we wanted to ask is, in newspapers there was a news regarding your vaccine, that Apollo Hospital is planning to make big arrangements for the vaccine storage, like the big freezer facility and all. Is it keeping in mind only regarding the COVID vaccine, or is it general? Are you planning to step into the vaccine industry, or is it only for the COVID vaccine?
Unfortunately, the Indian mindset only recognizes vaccinations for the children. But adult vaccination is a huge opportunity, which is actually got the capability of reducing morbidity and mortality in the elderly age group, in the adults. So adult vaccination has taken a backseat, and we believe that adult vaccination, apart from COVID, needs to be actually propagated, and people need to start getting a simple flu vaccine, a pneumococcal vaccine, or diphtheria vaccine. All of these are preventable diseases, and you have vaccines which are available, and we are running behind a disease for a vaccine which is not available. So I think the first thing which we need to understand is that vaccines, adult vaccines are available, and they are as important, if not more, as the vaccination in the children. Now we have this system in place where we, vaccine is a much more complex entity compared to a lot of other medications that we use, and vaccines need to be stored at a particular temperature, and the potency of the vaccine needs to be maintained to ensure that the entire supply chain is in proper shape. Otherwise, the entire potency is lost, and giving the vaccine becomes a huge wasted exercise. Now, for a country with 1.3 billion people, even if a vaccine becomes available, and when it becomes available, that's still a big question mark. We need to have the infrastructure to be able to supply and take it to the last man in the furthest village and be able to vaccinate them. So for this, to be able to do this, we did a calculation. We actually mapped out our facilities across the healthcare spectrum, including hospitals, clinics, pharmacies, and multiple other formats of healthcare. And we realized that we are within 30 minutes of reach of 30% of the Indian population. So that is a huge segment. So we thought it is our responsibility to make sure that if once the vaccine comes in, we will be able to be accessible to this segment of the population, which can access it within 30 minutes. And we have already started creating the infrastructure required for it, adding to the existing infrastructure. And we've already started training the people. It's not only about the supply chain, it's also about the people to administer the vaccine. Where do we have the people to administer vaccine to 1.3 billion people, 1.3 billion people. So we have also started training people, and we think that we can do about 1 million vaccines every day, and we will need about 10,000 trained personnel in our infrastructure to be able to reach out to 30% of the population in the country. And we are geared up towards that. We are still waiting for the vaccine, and then there's a lot of other things which are required, the government approvals and the rest of it. And finally, now we've seen that it's become a political issue. It's become an election issue with the government promising free vaccines and stuff like that. So we really don't know where it is going to end. But we want to reassure the country that we are prepared and for such a large exercise, and we will be able to respond when the challenge comes up.
Thanks a lot, Dr. Hariprasad. Thanks a lot for spending your valuable time with us. We request you to continue in this session at least for next 10 to 15 minutes if possible.
Okay. I'll disappear somewhere in between, don't worry.
Okay, sure, sir.
Harish is there, more than cover up for me.
Dr. Soumya, Mr. Arvind has a question, I guess.
Okay. Mr. Arvind?
Yeah. Thank you.
I think I will introduce Arvind before that. After that, he can shoot his question.
Yes.
Now, I would like to introduce our third panelist, Mr. Arvind Ravikumar, CEO, WebCardio. Arvind is the CEO of Gadget Medical Systems, the company behind the WebCardio Connected Care platform. He is an ardent believer in India's ability to have the most digitally enabled healthcare system that is inclusive and affordable in the very near future. The first application of the WebCardio platform is ambulatory cardiac monitoring has found great acceptance among the cardiologists. WebCardio is expanding to remote patient monitoring and also other areas of digital healthcare. Okay, now Arvind, you can ask your question to Dr. Hariprasad.
Thank you, Soumya. Good afternoon. Doctor, my question is, in healthcare, unlike other startups, the time involved and the interaction required is quite high. Like you can always make something as an engineer in isolation, but once you go and interact, you will understand it doesn't solve the real problems. You might have got obsessed with a particular technology. It is not adding value to the doctor. It's not adding value to the patient, and it is not in alignment with the workflow. So here, it's very important that an early engagement and a channel of collaboration exists between healthcare providers, hospitals, and the technology community, which allows to have early feedback interactions with doctor. And you have to witness the healthcare as it is happening. You take a survey, you take an interview of a doctor, you get some information, but when you actually go and be part of it. For example, I did that initially when we were introducing the product. During the initial clinical validation, I was there during that entire period. So I understood certain things entirely differently. The stress under which the staff is working, how your technology can complicate things for them. So my question is, we need to have a practice where the entrepreneurs in healthcare sector is considered also as part of the system, working towards contributing to this digital transformation, and they should find some accommodation into the system so that they can also do value add. So what your...
I think you nailed it. I think if technologists work in isolation, then startups will remain startups. I think working with the providers is the most important thing. And I think any of the large healthcare systems that exist in the country, whether it's Apollo or Aster or any of these, would welcome new technology and would actually be happy to work with technology partners to create new solutions. But what we see actually happening on a majority of occasions is people have already made a product and come and present us with that product, and it may not be of value to the stakeholders. That's where the real challenge comes in. And I would imagine that 1 out of 10 startups really become successful. And the reason is because they have not worked enough with the providers and the stakeholders involved in taking up the technology. I'll just give you one example. We do a lot of preventive healthcare. Probably we do the largest number of preventive health checks in the world. And what we realized is the biggest cancer in the country is cervical cancer, cancer of the cervix, and it occurs in the lower socioeconomic groups. And most of the lower socioeconomic groups stay away from the large metros and cities and away from the large hospitals. And the only way to diagnose it or in the early stage is a pap smear, where you have to take a smear from the vagina, send it to a lab. The pathologist needs to see it under a microscope, and then the report comes back. And when you actually go out into the periphery and take this smear, and this entire process becomes very cumbersome, and it is not practical to screen large segments of our population. There was one company in Israel which came out and said that they have a wonderful digital system which can photograph the tissues very well and with high resolution. So we actually worked with them, and what we finally came out with was a product where you just, any periphery you go and you don't do a pap smear at all. You do a photograph of the cervix, and the cervix that is automatically uploaded into the cloud. There is an AI in the cloud. So even before you've actually gone to the next patient, you would know, you'd get back the information from the cloud after the AI has gone through it, whether this patient is likely to have a cervical cancer or not. So you're actually screening a huge segment of the population very quickly, and you're able to segregate the high-risk patients and only take care of them and do the pap smear and further thing, whatever is required for that segment of population. So that has really worked very well. And that was because there was a need, the disease was there in the community. There was a ask from the medical fraternity where we said that the current system is very cumbersome, we need a easier and more efficient system, and it was very cost effective. It costs less than 10 rupees to do each of these tests for a woman, to screen a woman, which is very, very cost effective. So all the elements covered, it is one of the most sought after innovations in the country today. And I believe that hospitals have the providers have the responsibility to work with the technologists. And we would actually encourage, I can talk on behalf of Harish also, encourage all these people who are trying to work on whether it is digital or non-digital, any form of a solution for healthcare, to come to us, and we are more than happy to help you and work with you and join you in your endeavor. I hope that answers your question.
Yes, sir.